Hello, and welcome to the Balance of State Coordinated Entry New User Training. This session is intended to provide you with an overview of the way that the Maryland Balance of State approaches homelessness. But before we can get into the details of the system itself, it is important to understand the environment that we are working in. And that involves understanding the nature of homelessness, both as we know it in our own personal and professional experiences, but also our institutional understanding of homelessness. The public conversation around homelessness in the media tends to focus on homelessness in terms of ideas like mental illness, substance use, disability, and unemployment. But while these issues all intersect with homelessness, we know from our own personal experience that not all people who experience homelessness are mentally ill. Not all people who experience homelessness use substances or have a disability or are even unemployed. So rather than focusing on the ailments that often intersect with homelessness, we want to know what homelessness is at its core. It'll sound a little silly to you perhaps, but there's one thing that unites all people experiencing homelessness, and focusing on this unity will be important as we thresh out the definition further. Someone is homeless if they don't have a safe, adequate, and reliable place to live. Seems a little silly, doesn't it? But lack of housing is at the heart of why people become homeless. After all, you can be stably housed with a mental illness, you can be stably housed with a substance use problem or a disability, or you can even be unemployed. So our job in the world of coordinated entry is primarily to focus on the one unifying need, housing. This does not mean that the other needs are unimportant. In fact, they are so important that we dedicate a lot of time and work to make sure that needs such as substance use and mental illness are taken care of in our homeless services system. But our homeless work is grounded here, as well as a lot of the money and finances that come in to fund homeless services through agencies that tend to do work with housing, whether that on the federal level is Housing and Urban Development, or here in Maryland, where I am at the Department of Housing and Community Development. We work a lot with other departments such as Health and Human Services and Labor and Employment, all of which are really important to the overall and overarching interdisciplinary conversation on homelessness. But the subject matter here and what is essential for our goal today is to focus on housing. This is also why the federal definition of homelessness primarily focuses on one's living location as a determining factor of homeless status, rather than some of the other things that may contribute to their homelessness. So what is this notorious federal definition that I'm alluding to? Well, I'll show it to you, but I'll warn you it's quite long. But we'll break it down into digestible pieces very soon. Don't worry, by the end, you'll be a master at this. The most important component of these definitions is that they're broken down into 4 categories. These categories are not specifically based on vulnerability, but based on current living location. The idea is that we can target different resources to people based on their current predicament in order to ensure that we are being as judicious as possible with our resources. So we will start with Category 1 homeless. Category 1 also uses the alternative terminology you may have heard sometime, literally homeless, which may sound a bit strange, but the term is intended to capture homelessness as it is popularly understood. To qualify as Category 1 homeless, there are a couple of different living locations that would allow you to meet this definition. A client can be staying in an emergency shelter, which is defined as a short-term, immediate stabilization option. The best way to determine if a temporary living location is an emergency shelter is to consider whether being homeless is required to stay in the shelter and whether a lease or a tenancy agreement is signed. For comparison, a treatment program may allow you to enroll even if you have somewhere else to live, or a temporary housing program may require tenants to sign leases or may require tenants to sign some form of tenancy agreement. In this case, neither of those would qualify as emergency shelters. Next, you could be staying in a hotel or motel paid for by a nonprofit or government organization. If a client is paying for the hotel or motel on their own, they would not qualify under this category, even if they have nowhere else to go. Likewise, if a friend, family member, or other private benefactor is providing for the hotel or motel, they would similarly not qualify. Next, they could be staying in a transitional housing program. Please note that a lot of shelters may call themselves transitional housing programs. The key to determining if a transitional housing program qualifies under this rule is if they have homelessness as an eligibility criteria for the program and if the model is relatively self-contained. Unlike a shelter, clients in transitional housing are often intended to move into housing after a set period of time, often 1 or 2 years, and the client may have to sign an agreement, though not a full lease. Alternatively, a client may be staying in a place not meant for human habitation. This can be anywhere outside, in a tent, in their vehicle, or in an abandoned building. It's important to note that HUD draws a distinction between substandard housing and housing that is not fit for human habitation. It can sometimes be a subtle difference, but the key is that a substandard housing unit is not up to code, while a place not meant for human habitation is often condemned or eligible for condemnation in your jurisdiction. Often a client is paying rent for a unit that is substandard. If that's the case, there are remedies through the court system to ensure that the unit is brought up to standards. So typically clients staying in abandoned buildings are not paying for the housing. The designation has to do with the client's ability to assert his or her rights to habitability under the contract for the lease. This line can be really fine and can sometimes be subtle. A leaky roof that the landlord refuses to fix would not necessarily qualify as a place not meant for human habitation, but a massive hole in the roof likely would, even if the client is paying for rent. This means that it's often a judgment call to determine whether a place not meant for human habitation qualifies as a legitimate homeless location. If you're on the fence about whether a unit is substandard or abandoned and really meets that not meant for human habitation definition, please just be sure to document the conditions in the client's paperwork. And you can always reach out to us at DHCD for more specific guidance. A lot of clients are going to be on the line here, and it can be very difficult to make a call. But if you make the documentation in good faith and do your best to record the conditions of the client's living situation, you're going to be okay. Next, we have what we call institutional settings. This definition can get a little complicated, but don't worry, we can break it down pretty succinctly. With institutional settings, we are suddenly concerned with a client's past homelessness. This is a bit unusual for other Category 1 criteria, which is really just concerned with where the person is staying last night. With institutional settings, we are concerned with where the client was staying the night before entering the institution. This is kind of the same as the night before principle from above, but we're really looking at the night before their entry to the institution. So if the clients were staying in any of the 2 boxes above, shelter or place not meant for human habitation previously, then entered an institution such as a prison, jail, hospital, mental health facility, or something of that nature, and finally is now exiting that institution having stayed there for less than 90 days. So you need all 3 to qualify. First, be on the streets or in a shelter. Second, in an institution currently. And third, exiting before 90 days in the facility. If all 3 of these conditions are met, a client in an institution is considered Category 1 homeless. So a client can either qualify for this definition under the first box, the second box, or the third box. But if the client qualifies under the third box, all 3 of the elements must be met for the client to have Category 1 status. Next, we will discuss Category 2 homelessness. This category does not come up a lot in our discussions of coordinated entry, and that is because most mainstream resources are not accessible for those who are either Category 2 or 3. However, it is still important to learn this definition for 3 reasons. First, we still hope to serve people who are Category 2 and 3, just not through rental assistance funds. This means that you can expect to assist people in this definition now, just through means other than paying one's rent, such as having problem-solving conversations or providing one-time assistance. Second, it shows where we're going and our future system planning. We hope to invest more time and resources into clients that meet Category 2 and 3. And finally, it highlights some gaps in our service model for certain clients, and we really hope that it can inspire you to create creative solutions to these problems within your own communities. So let's actually get into the definition. We begin with clients that are currently housed. That is essential for Category 2 homelessness. The client is not yet on the street or in a shelter or a place not meant for human habitation. Next, they will lose their housing in 14 days or less. This could be because of a formal eviction, or if the client does not have a lease or is couch surfing, an informal eviction could also qualify. In addition to being currently housed and planning to lose housing in the next 14 days, the client must not have identified a subsequent residence. No other homes are available to go to. And they lack the financial assistance to obtain other housing. This includes everything from money for a security deposit or a down payment, all the way to money for a hotel or motel. If the client can afford to pay for a motel stay after leaving housing, they do not qualify. They must also lack a support system or social network. This can be friends, family, or faith-based. Note that this is specifically looking at permanent housing. So, for example, if they have money to pay for a hotel room for long enough to support themselves in order to obtain other permanent housing, they would not qualify. But if they have money for a hotel room for a few nights, but that money is not enough to support them through the entire transition period, they would qualify as Category 2. Another important thing to note is that to qualify a client under this definition, it does require some investigation into their outside financial resources. This means that before serving a client who is Category 2, even in funding sources that allow you to, which most don't, you still need to have a problem-solving conversation with the client to confirm that they have no subsequent residence. Next, we will talk about Category 3 homelessness. First, this definition will only apply to youth-only households, which is defined as a person under 25 years of age, or to families with minor children, meaning under 18. Note that this "or" is not exclusive. A youth-headed household with minor children would definitely qualify under this definition. Next, this person must not be eligible for services under any of the other HUD definitions, either Category 1, Category 2, as we had talked about, and then Category 4, which we will talk about very soon. Though they may qualify as homeless under other federal definitions from other federal departments, such as Veteran Affairs or Education. In addition to being a youth or family, the person must not have had a lease, ownership interest, or occupancy agreement for any permanent housing in the past 60 days. You'll notice that this lease or occupancy agreement sounds pretty similar to our dividing lines between shelter, transitional housing, and rental housing. This hints a little bit about what HUD typically considers to be housed. Next, they must have moved 2 or more times in the past 60 days, and this condition is expected to continue because of any of the following: a chronic disability, substance abuse, histories of violence, childhood neglect or abuse, the presence of a youth in the household with a disability, or 2 or more of the following barriers to employment: a lack of high school degree or GED, illiteracy, low English proficiency, history of incarceration, detention for criminal activity, and history of unstable employment. While it may seem complicated, and knowing that Category 3 clients don't qualify for most coordinated entry programs might seem unnecessary, but I think it's still really important to understand this definition to consider who might qualify for support either through non-CE funding sources or through non-rental assistance methods like problem-solving conversations or one-time assistance. Next, we will look at Category 4 homelessness. Category 4 homelessness specifically concerns clients fleeing or attempting to flee domestic violence. A lot of times where somebody is Category 1 homeless and the reason for their Category 1 status is because of their history of domestic violence. That is not what this definition is intended to capture. So logically, a client can be both Category 1 and Category 4 homeless. While a client who's fleeing domestic violence is important to note even if they're Category 1 homeless for the purposes of documentation under the Violence Against Women Act, which we'll go over in a future training. However, when we're looking specifically at Category 4 homelessness, we're looking at clients who would typically not qualify as Category 1. If they are Category 1, then in this case, they would meet both definitions. They'd be both Category 1 homeless and Category 4 homeless and would qualify for all programs in coordinated entry that serve Category 1 or 4 clients. A client is Category 4 first if they're currently fleeing or attempting to flee domestic violence, dating violence, stalking, sexual assault, human trafficking, or other dangerous or life-threatening conditions related to violence affecting their primary nighttime residence. Next, the client must also have no other residence. So even if they're fleeing domestic violence, if they have a safe home to go to, they would not be considered Category 4 homeless. Finally, they must also lack financial means to obtain other permanent housing or lack support systems or social networks such as friends, family, or faith-based to obtain other permanent housing. You'll notice that this last box is very similar to the other box from Category 2 homeless. we're looking at pretty much the same criteria here, but in this case, it is for someone who is fleeing domestic violence. To be Category 4 homeless, all three of these boxes must be met. They must be fleeing, they must have no other residence, and they must both lack financial means to obtain other housing or lack the support system or social network to obtain other permanent housing. Next, we will talk about the ever-daunting chronic homeless definition. The chronic homeless definition can be a little bit intimidating at first. The definition is a little strange. It kind of sits outside the other four categories, but it also kind of sits inside the four categories. It's kept separate. Chronic homelessness is not a category of homelessness so much as a condition that sits on top of somebody's existing homeless status. In this case, it is a client who is Category 1 homeless. First, the client must have a disabling condition. This is a universal requirement. Even if they meet all the other components of the chronic homeless definition, if they do not have a disability, they do not qualify. This disability has a couple of criteria. There's 3 prongs. Either 1, it is long continuing or indefinite in nature, could be improved by housing, and is a physical, mental, or emotional disability, including those caused by drug or alcohol abuse, PTSD, or brain injury. This next prong is a developmental disability. And the final prong is immunodeficiency or HIV or AIDS. So, in order to have a HUD-eligible disability under the chronic homeless definition, they must have either the first prong, which is long continuing or indefinite, could be improved by housing, and is a physical, mental, or emotional disability, or they can have a developmental disability, or they could have an immunodeficiency such as HIV or AIDS. Next, they must currently be residing in an emergency shelter or a hotel or motel paid for by a nonprofit or government service. Or they could be in a place not meant for human habitation, or they can be exiting an institution where they were previously staying in a shelter or on the street and there for less than 90 days. Note that this box is almost identical to the Category 1 box from above, but there's an emphasis on almost. You'll notice in the top box where we look at emergency shelter or hotel or motel paid for by a nonprofit or government organization, there is no transitional housing. So a client who is Category 1 and staying in transitional housing, regardless of meeting the other definitions, would not count as chronically homeless. That is the one carve-out exception where otherwise all clients who meet the Category 1 definition can qualify as chronically homeless unless they're in a transitional housing program. This can be a little confusing when we get into eligibility criteria, but I want you to remember when we look at eligibility, we're often looking at Category 1 status. When we're looking about prioritization, we're looking at chronic homeless status. This will all be a little more clear in a future video. So why is transitional housing missing? It has a lot to do with the role that the chronic homeless definition plays in eligibility specifically for permanent supportive housing. Clients in transitional housing are often in a self-contained model that is intended to move them into permanent housing in 1 to 2 years. As a result, the chronic homeless definition was constructed in a way to prioritize those who are not in a self-contained model and are currently in a homeless shelter or on the street, and therefore in a position that would make it more difficult for them to obtain housing otherwise. Next, we're going to break all the rules and start looking at a client's homeless status for an extended period of time. All of the other statuses of homelessness were really concerned with where the client was staying last night. The only time in any of the previous definitions that we departed from the where were you staying last night question is when we were looking at clients in institutions. But even then, we were just looking at when they entered the institution. In this case now, we're looking at a client's history, specifically using time as our main element. In addition to the other 2 boxes, disabling condition and currently homeless, first, the client must have lived consecutively in one of the locations in the middle box for the past 12 months. I want to emphasize that this is a location in the middle box, not a Category 1 location for the previous reason of transitional housing. So a stay in transitional housing would be considered a break in a client's chronic homeless status, even though they were considered category 1 otherwise during that time. So if they were staying in any of these locations uninterrupted for the past 12 months, they would qualify. They can very easily have bounced around between different locations. They could have stayed at 3 different shelters. They could have moved between different states. They could have moved between different jurisdictions. They could have stayed at one point in a place not meant for human habitation, then entered an institution, then exited it again. As long as they were at all points for no more than 7 days residing in a location that wasn't an eligible chronic homeless location, then they would still qualify for this 12-month criteria. Alternatively, the client has had 4 or more episodes of homelessness in one of these locations for the past 3 years, adding up to a total of 12 months. All right, so now we just added a new word. What is an episode? An episode is a period of homelessness followed by a break, or the present. A break is a period of non-homelessness for 7 or more days, or for 90 or more days in an institution. So if a client was in a transitional housing program for 7 or more days, if they're staying on a friend's couch for 7 or more days, if they had rented for 7 or more days, that is considered a break in homelessness. If it was less than 7 days, it is considered a continuation of their previous homeless status. Likewise, in an institution, if they were in the institution for over 90 days, that would be considered a break. So if you look at a client's breaks and you put them together and you notice that there's been 4 or more distinct episodes of homelessness in one of these locations, looking back into the past 3 years, and that adds up to a total of 12 months, even though those 12 months were not consecutive, as mentioned above, they would nonetheless qualify as chronically homeless. So let's go over it one more time. First, the client must have a disabling condition. Even if they meet the other 2 boxes, they are not chronically homeless without a disabling condition. Next, they must be currently residing in an emergency shelter or a hotel or motel paid for by a nonprofit, or a place not meant for human habitation, or an institution where they were previously staying in a shelter or on the street, and they were there for less than 90 days. Finally, in any of those locations, they've either lived consecutively for the past 12 months or episodically, with 4 or more episodes of homelessness in the past 3 years, specifically meaning that there is an episode, then there is a break, then there is an episode, then a break, an episode, then a break, and a 4th episode, and either a break or the present. It could be 4 episodes, it could be 5, it could be 20. But as long as they have those 12 months and that time period adds up to 12 months in total, they would meet this chronic homeless definition. You'll notice that this is a really hard definition to meet, and that is for a reason. The chronic homeless definition is mostly intended to use as a gatekeeping mechanism for permanent supportive housing, which is a very scarce resource. When we talk about housing inventory in a future video, it's really important to remember that permanent supportive housing is very uncommon, does not come up very often, and therefore we must be very judicious about the clients that we place within it. We talked in the chronic homeless definition about months of homelessness. For example, needing to meet 12 months of homelessness in order to qualify as chronically homeless. But what is a month? Does the client need to be homeless for every single date of that calendar month? Does it just mean 30 days? What makes it so that a client can be considered to have 1 month of homelessness? Well, HUD makes this pretty simple. For the purposes of this definition, a month is 1 date within a calendar month. That would then grant the client the entire month to add to their homeless status. Therefore, whether an episode of homelessness starts on March 1st or March 31st, the client can add the month of March to their total homelessness. This nuance is why we speak in terms of 12 months of homelessness rather than 365 days of homelessness, because we understand that in many cases, the months will not be complete months. So on April 1st, the client can add the entire month of April to their homeless history, even though it's only been 1 day. Let's do an example together to apply what we just learned. In this case, we have a character named Jake. It is August of 2023, and Jake is currently living in a shelter. He originally became homeless 20 months ago when he lost his job and could no longer afford the rent. After losing his home, he went to stay at a friend's house for 3 months, where he tried to recover. Unfortunately, he was not able to stay there very long and ended up sleeping in his car for another 3 months. Then he was hospitalized, where he underwent an intensive surgery and had been admitted for 89 days. When he exited, he discovered that his car had been stolen and went to sleep in a tent in the woods. He lived there for 1 month until a street outreach worker connected with him and invited him to an emergency shelter. He stayed at the emergency shelter for another month until he noticed that his health condition was acting up again. He ended up readmitted to the hospital, this time for 4 months. Afterwards, he left the hospital and returned to the shelter, where he is staying to this day. Jake has a qualifying disability. Jake, while fictional, has a lot of similarities with some clients that you may have worked with before. In order to figure out whether or not this client is chronically homeless and what category of homeless they currently are, we would first need to break down all of the elements of this story and determine where the client was staying and for how long. So here, I have highlighted all the references to dates and lengths of time. I am also going to highlight the locations where the client was staying during that time. Finally, I am highlighting the fact that this client has a disabling condition, which is relevant for his chronic homeless status. So here is our timeline. This client became homeless in December 2021, which we know because it's 20 months before the present, which is August 2023. The client then spent 3 months at his friend's house. At this point in the story, we have no indication that Jake is homeless at all at this point, under any of the HUD categories that we have talked about previously. First of all, we have no indication that Jake is a youth, and we have no indication that Jake is a family with children, so category 3 homelessness would be off limits. We know he's not staying in a emergency shelter on the streets or place not meant for human habitation or exiting an institution, so he would not qualify as category 1 homeless, and he is not fleeing domestic violence according to the facts of this hypothetical. If he were to lose his housing in 14 days, let's say in this situation, his friend tells him, I'm sorry, you can't stay anymore, and gives him less than 14 days to leave, and he has nowhere else to go, and he lacks the financial means to obtain other housing, and he has no other support system, meaning no other friends or no other family who are willing to take him in, he would qualify as category 2 at this point in the story. However, this is not the end of the story. After leaving his friend's house, he spends 3 months in his car between March of 2022 and June of 2022. This means that he has now been homeless in a category 1 capacity for 3 months. So if the story were to end here, he would be considered category 1 homeless, though not chronic because the total number of months is less than 12 and it is not consecutive or meets the 4 episodic category. After he leaves his car, he goes to the hospital between July 2022 and September 2022. In the story, he was there for 89 days. This is less than 90 days. As a result, it is not considered a break in his homelessness. So the time that he spent in the hospital gets added to his total. So because he had 3 months from when he was staying in the car, we now add the 3 months in the hospital, which would make a total of 6 months. Now, 89 days may be a little less than properly 3 months, but in general, as far as HUD is concerned, as long as there is 1 day of homelessness within a month, the entire month will count towards the client's homeless status. Next, we have the client leaving the hospital and staying in a tent in the woods for 1 month between October 2022 and November 2022. Okay, so this is a category 1 location, just like the hospital before it, just a different one. In this case, he is staying outside on the streets or in a place not meant for human habitation. Please note that per our definition of an episode of homelessness, this client still has only had one episode of homelessness, even though at this point he's been to 3 different locations. There can be several different locations within one episode. When he moves into the shelter on November 2022, we now have 8 months of homelessness total, but it is still the same episode because there is no breaks. So he has one extended episode that begins in March 2022 and continues to, at this point in the timeline, December 2022. And it comprises a total of 8 months in total and 8 months within that particular episode. Afterwards, in January 2023, per the story, he moves into a hospital. This movement into a hospital is considered an episode of homelessness so long as it is less than 90 days. However, in this story, the client is there for longer than 90 days. He is there for 4 months, and that means it is now a break in the client's homeless status. At this point, if the client were to have to leave the hospital within 14 days, he could qualify as Category 2, but will not qualify as Category 1 again until he is discharged to either the street, a shelter, or a place not meant for human habitation. After leaving the hospital, he returns to the shelter, where he stays between May 2023 and August 2023. These months in total make the total months of the client's homelessness 12. Since we're at the present, we can decide once and for all what category of homelessness this client is. And that's pretty easy. He is in a shelter, so that means he is considered Category 1 homeless. The harder question is he chronically homeless? Well, let's look at our chronic homeless chart again. So first, we check if he has a disability. Yes, he does, so he meets the first box. Next, we look at his current living location. We just established that it is a Category 1 location, which means that the client would qualify so long as that Category 1 location is not a transitional housing program. It is not. He is staying in a shelter, so the second element is met. All right, now for the hard one. We're going to be looking at the third box of the chronic homeless definition. So, does he have 12 months consecutively of homelessness from the present? No, he does not. The time frame between May 2023 and August 2023 is 4 months, which is less than 12 months. Prior to his enrollment in shelter, he was in the hospital for over 90 days, which means there is a break. Therefore, his homelessness is not consecutive, even though he has a total of 12 months of homelessness. Okay, so let's go to the second definition within this criteria. Does he have 4 episodes of homelessness within the last 3 years, adding up to 12 months total? Well, we can see he meets some of these criteria. He's got 12 months total after all, and that is within the last 3 years. However, there is only 2 episodes of homelessness. Returning once again to our definition of an episode, which is any number of locations that's not separated by a break, we can see that there has only been 1 break. He had 1 episode from March 2022 where he began to live in his car all the way until December 2022. He stayed at several different locations: a car, a hospital for less than 90 days, a tent in the woods, or a shelter. However, this is all 1 extended episode of homelessness. He then has a break and then begins his second episode. That stay in the hospital lost him his chronic homeless status. At this point, he either needs to wait another 12 months total, so from May 2023, that would extend until May 2024, in which case he would have 12 total months of homelessness that is consecutive. Or if he has, within the same time frame, another 2 breaks, which would put the total number of episodes to 4. This is a good example because it demonstrates that the chronic homeless definition is not always intuitive. We sometimes say 12 months is a shorthand, but the definition is a lot more technical than that. As of the recording of this training, many LHCs within the balance of state still use this chronic homeless definition in order to determine eligibility and prioritization for permanent supportive housing. However, there is another definition called dedicated plus, which some communities may use. In summary, dedicated plus works very similar to the chronic homeless definition. They can both be used for prioritization, and they both grant a client status as chronically homeless. However, clients who are dedicated plus do not need the 4 episodes of homelessness within the past 3 years. It only requires 12 months. So, this client, Jake, would qualify under the dedicated plus criteria, but not under chronic homelessness. For those familiar with the dedicated plus definition, there are a few other nuances of the definition that I am leaving out here that may affect clients who are currently in housing, as well as veterans. However, these will be topics that will be saved for another training. Between LHCs, and even within an LHC, there may be several different programs that use different definitions of homelessness between chronic homelessness and dedicated plus. That's why it's important to always consult with the person in charge of your housing inventory in your community and to learn both definitions just in case. For the time being, please assume chronic homelessness unless you are given instructions otherwise. That's all for today, but before we go, I wanted to give you a sneak peek at a future training. One of the reasons we talk about the categories of homelessness is because it ties in very closely to the housing intervention models that we'll talk about in our next video. Because resources are scarce, different intervention types are targeted to different clients in different categories. So, for example, chronically homeless clients can be targeted for rapid exits, mainstream housing, rapid rehousing, or permanent supportive housing, while Category 1 clients that are not chronically homeless would be targeted for rapid exits, mainstream housing, and rapid rehousing. Category 2 clients, those at risk of becoming homeless, would be placed in prevention and diversion or mainstream housing. Category 3 clients would go into prevention and diversion, mainstream housing, or youth dedicated rapid rehousing. Similarly, family dedicated rapid rehousing. And then finally, Category 4 clients, those fleeing or attempting to flee domestic violence, would go into prevention or diversion, mainstream housing, or rapid rehousing. In this way, the different types of housing interventions that we'll talk about in a future video, we don't expect you by any means to know what all of these fancy words like rapid exits and permanent supportive housing mean, but for the time being, it's good to know that different interventions are targeting different categories of homelessness, which is one of the reasons why it's really important to learn these definitions now. All right, thanks everyone so much for joining. That is all for today. Please don't forget to take the quiz.